All right, ladies, so I want to show you real quick on how to treat the legs. So Joyce has been a client of mine now for about how many months now?
At least 9.
9 months.
10, I don't know.
9, 10 months. Okay, not even a year yet. So she's given me the ability to be part of her journey to change the state of her fascia, make it nice and smooth. So she's heated up already. She heated up in my sauna. She used her sauna suit from Ashley to get nice and warmed up before she got here. So she is nice and hot. So I'm going to show you real quick on how to approach the legs with a little bit of blading and a little bit of cupping. So first things first, I'm going to grab my blade and I'm going to scan for adhesions. Okay, so you see I'm at an angle. She's got a little stuff building up around her knees. She has had previous injuries to her knees. Is this the one you had the surgery on?
Yep.
Okay, so that answers my question as far as why is there adhesions hugging around the knee from the back. I'm not gonna go in the back of the knee. I'm leaving that area alone because we have a lot of delicate structures in there. I'm just going above the popliteal fossa. So she's got a lot of stuff going on here, especially right here, and she feels it.
Yep.
Okay, light pressure. This is plastic. I'm not adding any pressure to it. I'm just smoothly going up to her legs, up and down if I wanted to. I also like going one direction with it. Now once I have found those adhesions, I like to get in there with a prep tool. This is the paddle blaster. I've cut it up because it's easier for me to feel any pebbles, any gravel, any restrictions, distortions. How's that feel, Jay?
Amazing. It hurts there, but it feels good.
Right? Exactly where we found those adhesions, right? That's exactly where it is. That's where it bothers her. Right where those guys are collecting. Right behind her knee. So she sits for long periods of time, so it's obvious that she's going to build something here. Restrictions. She's going to build restrictions behind her knee because her knee is constantly in this position for 8 hours straight.
At least.
At least. Maybe longer because she's driving for 2 hours. So we're going to go in there. Going to go into her just like that. I don't really use the cuppings on the cupping modality on Joyous, so that's why I wanted to prep the tool, the prepper skin first before I go in there with the cups. So I'm gonna put the cups right where she feels the adhesions, which are right here. So I'm just gonna do one pump, that's it. Goes a long way. And she feels the pull. Do you feel the pull on the tissue? Okay. That's all I need. Right there. That's it, just one pump. And so I'm gonna leave this area alone and move on to the next leg while she's, while that blood is flowing into her legs. And then I'm gonna use my blade, again, at an angle. And sure enough, again, she has it built up right here. Not so much here. It feels really nice and smooth here. Everything's here. So these tools serve as an extension of our own hands, guys. We're playing detective. When it comes to our bodies, trying to figure out where's the imbalance, we have to play detectives. I have mentioned before, just because you have pain, let's say in your calf, it does not mean that that's where the pain is. It could be above her leg or in your foot. That's why we have these amazing tools. We have amazing fascia blasters, so we can play detectives and see what's up, what's going on And we found some adhesions in here for sure. Okay, I'm gonna go in with the paddle blaster. Okay, I'm gonna release the cups. Been more than a minute. And go into her calf. Then we're gonna eye. So, from my blading, I could tell you there isn't a lot going on in this leg. Not as much as the leg that she had her surgery on. It was very little stuff going on back here. On the right leg. And just do this for a couple of more minutes. And we massage a little bit. And then we go in there with a massage tool. With a mini 1, mini 2, Big Daddy, or a original Fasciablaster. We're not doing anything crazy. We're just sliding up the tool. Sliding up the Fasciablaster. How's it feel, honey?
Amazing, thank you.
You're welcome. And then we're gonna go down the leg. And for my girls who have the silicone cups, I find that the silicone cups do better. The suction does better when there's no oil on the skin. So we're just gonna gently press the silicone cups right to the area where I feel the adhesions.
Yep, that's right.
You feel that, right?
Yep.
Gentle press, gentle suction. That's all you need. I'm gonna go in with a massage tool. So if you guys can notice, there's no purple. It's not purple. No marks. That's not the result we're looking for when it comes to cupping. You don't want to bruise. If you're just starting, you don't want to leave it there more than 30 seconds. You want to get the feel to your cups. Don't force it. Because remember, when you do something like that, your body recoils. So less is more. We're just facilitating the inflammation process of the body. And then we take the nugget to refine. Get in there and help the body get rid of this restriction. When Joya started seeing me, she used to have these big fat pockets on the side of her knees. It's amazing. You don't really see them anymore. They disappeared.
That used to be so painful.
Yeah, yeah. So this is exactly how you would attack a, a fat pocket. You would take the nugget and stimulate blood flow. That's how you reshape your knees, ladies. By just using a little nugget. Just like that. And go down and get into the gastrocnemius, which is your calf muscle. Gastroc is composed of two bellies, right and left. If you have issues with your foot going to one direction, check out which direction is facing inwards, inside the body like this. you address the medial aspect of the gastroc, because that is what's pulling your foot in. If you feel like your foot's going out, you want to target the peroneals, which are the muscles on the side of your leg, and the lateral aspect of the gastroc. Your foot looks actually really, really good.
Really?
Yeah.
Mm.
When I started with you, it was
Yep.
inward. Going with the paddle blasters just one more time. And then go in and refine. Just like that. And we flush. And then we release the cups of the other calf. And we flush. And we flush. There's no wrong way in flushing. You can do the entire leg down, or you just take it across just like this. Do you have any questions for me, Jay? Any questions that maybe a newbie would ask?
I've always had a hard time building my calf muscles.
Your calf muscles.
I have none. So what can I do to start sculpting them?
Sculpting the muscle?
Yes,
You
so
might
that
have-
I can, obviously I need to work out, but to help.
Yeah, you work out, but you want to isolate.
Yes,
You want to isolate the muscle. So, have you done calf raises?
I used to.
Okay, you
So
might
now
need
I'm gonna
to
start.
get back into it. Yeah, because what happens also is if you have discrepancies in the body, like if your foot's going inwards and you go in and start doing calf raise, your calf raise is going to build the one side of your gastroc, not both sides evenly. So you want to make sure your form is there
Okay.
when you start doing your calf raises. Make sure your foot's straight so you can build the gastroc muscle evenly.